Can your child learn how to read? The answer is yes. However, there are going to be many factors associated with how quickly and how successfully that occurs. First is the age at which intervention begins. Scientific research has shown that the earlier we can intervene, the better. So if you have a 6 or 7-year-old who begins intervention, that is preferred. The second factor is the severity of the dyslexia. Dyslexia does occur on a continuum: mild, moderate, severe. And no two dyslexic folks are the same. They're like a set of fingerprints. So some will come with certain strengths and other weaknesses, whereas someone else will look entirely different. The intensity of the curriculum and how often the child is seen also is a big factor. So the type of curriculum that's actually being used, if it's specifically designed for a child with dyslexia, if it has all the components necessary in order to fill in those holes. And then how often are you seeing the therapist or the tutor? 4 times a week is highly recommended. 5 is even better. A typical length of a session would be 45 minutes to an hour. Depending on the age of the child and their attention level and their level of fatigue and frustration, this can vary. And it's just important for the therapist and the parents to talk and make sure they have that they have a nice balance. And speaking of the parents and the therapist, this is very much a team effort. 3 players, of course, the student. The student needs to be on board. The student needs to realize that yes, she can learn how to read, but she's going to be working very hard in order to do so. The therapist needs to come prepared with the information in hand, with a plan. And finally, the parents. Parents are a really important factor. They must do the little bit of homework that will likely be assigned in order to make sure that the child is practicing the concepts that have been taught, and to make sure the child arrives on time and ready to learn with a full belly and a water bottle, eager to get started with their tutor.